around us. So please maintain social distance. Please keep yourself calm. Don't become victims or prey for the kind of happenings that's going around us. But at the same time, keeping ourselves very strong mentally and physically, eating things right, doing things right, keeping ourselves in the positive frame of work, it is also very, very important, and it is most required to lend a helping ear to people around us. There are so many people who are suffering, who have lost their near and dear ones, hospitalized, unable to get into hospital. The kind of agony, the pain around us is tremendous. And as it is, there has always been a lack of mental health professionals, psychiatrists, trained counselors. There has always been a severe dearth and lack of it. And now this is even many or multifold, the need is. So in that context, Rotary, in the COVID war room, they have come out with different kinds of activities, volunteering, and many such services. So in that, one of the aspect is offering counseling services. So in that context, this meeting has been held, and very nice that so many of you have expressed interest in lending a helping hand. But there will be a confusion like, should I be a trained counselor? I've not done my basic training in counseling or anything. How do I reach out? Or I don't hold any certificate. I don't have any basic qualification in psychology. I don't understand human behavior. These might be the doubts. But at the same time, most of you have come here with some kind of a genuine interest, empathy, concern. So let us find out a little bit of yourself, your quick profile, and then we will see what best. This particular platform is quite fluid at this particular state, depending on what the inputs the participants you give and understanding the kind of skills and strength you bring into the platform, we shall decide how to go about. But before that, Krishna, can I share my screen? Have you enabled me?
Yes, ma'am. Please go ahead.
Okay, so COVID war room, this is one aspect of uh, service Rotary district is planning to offer. And we would be wrong if we call it as counseling, because counseling is a vast subject. So if we just say, I'm going to be a counselor, we may not be completely correct. In that context, I've just put it as, let us be good listeners, because we are quite far off from counseling. Because in the true parlance, counseling does require training, competence, understanding of human behavior. All that is a must. So let's not label the group or ourselves in the typical sense of counseling, but we are offering counseling services, but not in the theoretical sense. So I've just put it as, it is amenable to change. This is just my views I've just put here. So Rotary listens to you. Basically, we need to listen to people. It is said that actually the touch, a smile, a good gesture, a concern, a good helping hand and a ear can do wonders for people. And people are really looking for that smile, really looking for a hand over the shoulder. They are really looking for a good friend in whom they can confide. This has been the need all these days and years, but the need is tremendous now. And added to that, the power of touch is totally missing. You just forget the touch. You can't even go next to the person who is in pain. That is the kind of problem COVID has brought to us. So there's no touch, there's no proximity, there is no going close, there is no hug, there is no proximal affection, nothing. There is a void of human emotion. The moment we get to know that the neighbor or so and so is COVID positive, most people, I'm not saying everybody, lock the door and keep people at bay. In fact, I have been receiving so many calls and then need for help where father is hospitalized, mother is no more, only child at home, hardly 8 years or 9 years, and the neighbors have totally shut the door on this child because they don't know if the child is a carrier. Twin babies, mother just gave birth to twin babies, mother is no more, and nobody is ready to take this child. Son is no more, daughter-in-law is hospitalized, mother-in-law, 80-year-old lady She is an Alzheimer's patient and she is at home negative, but nobody to take care. This is the time actually people should have been there next to each other and helping out, but it is not happening and it is not possible for many reasons. So at least if the touch part is not possible, being close is not possible, the only thing what we can do is being a listener. That's all, my dear participants, at this juncture. What we can do is be an empathetic listener. Just give your good understanding ear to the people who are in need, who are in trouble. So that is all what we can do at this juncture. But listening is also not easy. We have all these years been taught how to speak, but we have never been trained how to listen. We are either ready with our next question when someone is talking, or we are judging the person when he or she is speaking, or we are trying to understand and say what reply I should give, or where he or she is making a mistake. We are getting ourselves prepared, or thinking about something, or texting, or sending messages. We are very rarely empathetic, understanding listeners. And to be a good listener, in fact, you don't need a pair of ears per se. What we need is, apart from the open ears, we need open mind, open eyes, and an open heart to understand. So if you have that in you, you can give this service to Rotary. There are people who are just waiting to be listened. And that, if you can do it, that'll be really good. So I just stop here and ask you this question at this moment. What skill or attribute do you have within yourself which can be developed, which can make you an effective listener or a good counselor? So there are many qualities, even to not just to become a listener, for a counselor, there are many qualities. And to become an effective listener itself, you need a lot of qualities. Everybody cannot become a good listener or an effective counselor. So quickly, you can introduce yourself and then tell me what qualities you have. Now that I've just told you basically what is required, we will be talking a little more of that, how we go about. But you can tell me. And I also want to know, since there is a shortage of time, I'm not taking a detailed introduction, but I would like Krishna and the organizers to prepare a database, a profile of the people who are interested in joining this group and their basic qualification, any particular training they've received. Do they have any knowledge of human behavior, human development, psychology, or any kind of counseling skills or training? So that is something that has to be maintained. Otherwise, here I can take if you can spend some time and just introduce yourself and tell me, that will be really nice. 29 people are there, and about 30 seconds for each of you. Let's start off with in the alphabetical order. Yes, please go ahead. Who is here, starting with A? Yeah.
We have
Please.
Arvind, sir.
Arvind, sir. Okay.
Yeah, good evening. How are you?
My co-president. Good evening, Arvind.
Good evening. Yeah, I'm a good listener. Yes, I can show empathy towards it. Not an issue. I think I can spare some time. And also, I know after your talk, probably we'll have one or two more ideas where we'll include to see that if it can be successfully done.
Okay, good. So thank you, President Arvind. So the time is very, very important. If you are able to give your time, wonderful. And plus you also say you have a good patient listening skill, wonderful. Thank you for that. Can we move on, please?
Krishna Arjun, yourself. Move on to Shobha, yourself. Dr. Madhurani.
Yes, Madhurani.
Or can you just directly to Kalpana Mahesh?
If, not everyone, randomly, let's go if we don't have much time.
Can I introduce myself?
Please.
I'm Rotarian Stephen Paul of IPP Rotary Bangalore East and present treasurer. I have a degree in psychology and I have a PGD in stress management, and I've been a trainer and a counselor in stress management for more than 15 years.
Wonderful, sir. You'll be a great resource to the team.
Basically, I would just like to say two things.
Yes, sir.
As a listener, we have to have patience and I have that.
Very good.
Secondly, I think the whole world needs a shoulder to lean upon it these days.
Absolutely.
And if Rotary can be that shoulder, it would be wonderful, because people are in a panic situation. I'll just tell you one small example. Yesterday, somebody called up at 11:30 in the night, called me up and said he needs an oxygen cylinder for his mother, whose SpO2 levels are 96.
Mhm.
So that is the level of panic that is set in.
True,
So
true.
we have to first create a sense of assurance with the family around the patient. Because if the
Absolutely, sir.
family is panicky, then the patient is serious.
True, sir.
So
That's
I think
exactly.
we should think on those lines.
Yes,
And it was
yes.
wonderful listening to you, ma'am. Thank you.
Thank you, sir. Thank you so much. So you'll
Can
be
I
registering, and the details will be shared, I hope. It's all there in the Google form. It's fine. Otherwise, also organizers will get back to you.
can
Yes,
I
sir.
come in, doctor? I am Bharti and I'm from Innerville.
Okay.
Basically, I don't have any experience in whatever you spoke, but I really want to do something and give back to the society at this moment of time. Even if I don't have any of the parameters what you asked me, whether I'm a good listener or what, I would develop that. And I just don't know anything else. Might be I need to have that coordination kind of thing wherein I'll fit in, and I will forward it to the respective doctors and counselors who are here.
Fine, Bharti madam. Thanks
Thank
for
you.
that.
Yeah.
Yes.
Thank you.
May I come in?
May
Good
I
evening,
yeah.
ma'am.
Yes. Yes, please.
Good evening, ma'am.
Good evening.
Yeah, Prasanna Kumari from Bangalore Lakeside.
Okay.
Hi, ma'am.
Hello, ma'am.
Yeah.
How are you? Yeah.
I'm good. See, ma'am, I have a very empathetic mind, and I do talk to people through BBMP volunteer group, and every day 5 to 6 calls I do. So I think I have a very good hearing skill and empathetic mind.
Okay. Good. Good, ma'am.
May I come in, please? Hi.
Shubha ma'am, this is Hema again.
Okay.
Hema Malini. Yeah.
Yes, please.
Yeah. So basically, same thing. I have an empathetic, some background family of doctors. Brother is a doctor and uncle, aunt. And also my daughter is a psychology final year. And primarily she is into psychology because of probably my this thing influence, more into the listening and, very empathetic. I have a background of interpersonaling, coming from an HR background myself. So I think I definitely want to participate here, and definitely I think I'm a good listener, and I think I do this quite often with maids, with domestic help and things. I think I'll be able to contribute something
Good. Good.
with your, of course, guidance.
Okay, sure. Thank you.
Good
Thanks.
evening, Dr.
Good
Shobha.
evening,
This is
Lavanya, ma'am.
Lavanya
How are you?
here from Spandana.
How are you doing?
I'm better, ma'am. I'm
Okay.
out of the COVID thing.
Okay. How is Shankar, sir?
He's also fine, ma'am.
Okay. Please go ahead, ma'am.
Yeah, so I'm a professional counselor. I practice, I practice in Uttarali. Definitely, I would want to be a part of this group, because as it is, I'm seeing clients with a lot of panic and stress now. Whatever best I can do into this group, I'm ready to do it. And I think one more added thing now is that I just recovered from COVID, so I know what it requires. Even for a counselor, it wasn't like there was stress, there was anxiety. There's still, I won't say that little bit of anxiety that goes on, but strength of the mind is very important, and how we can help them. I think with first-hand experience now, I know how to talk to them.
Yes.
Even more, understanding.
Conviction you'll be able to. True, ma'am.
Yeah, so that is what.
Yes. So IJKL, we have come to. Let's move on.
May I
Dr.
come in?
Shobha, this
I'm
is
Yeah.
Dr.
I'm
Madhurani
Kalpana
Gowda.
Mahesh.
Kalpana is here. We'll finish
Yeah.
K and then come to M.
Yeah. Good evening, everyone.
Good evening.
I'm Kalpana Mahesh. I am a trained counselor. I did my post-graduation in clinical psychology and MS in counseling, and I had my training from NIMHANS. I have worked. I participated in 5-6 workshops in NIMHANS, and I was working as a counselor in government juvenile home and reception center for 15 years. And then I was a visiting counselor in 2 colleges. And presently I'm working as a freelance counselor.
Good, ma'am. Very nice.
Thank
It's
you.
a great strength for the group. Yes, Madhurani, madam, please go ahead.
Yeah, hi, Dr. Shobha. Elarigu namaskara. This is Dr. Madhurani Gowda, President-elect of Jainagar. And we have met a couple of times, Dr. Shobha. How are you?
That's nice. I'm good, ma'am.
Yeah, okay. I just want to introduce myself as a counselor, transformational trainer, and youth activist. These are the three paradigms I work on. And as a counselor, I'm from 1.5 decade. I'm working under the guidance of Dr. C.R. Chandrasekhar of Nimhan. So, and last year also with the war room, we were associated with the police department, and around 203 counseling cases we have done. So I would love to rejoin and be a part of this. And I request one and all to make of my use of my services as and when required. I've done my diploma in counseling and practiced for 1.5 decade.
Nice. Good.
Thank
I have
you.
met you in Rotary circles or with Dr. C.R.
Yeah, yeah.
Chandrasekhar, ma'am?
Both.
Both. Okay.
Your Nisha is my co-president.
Yeah, right.
Bellare. Yeah,
Go
okay.
ahead. Thank you.
Thank you.
Just a
You're
second,
done
ma'am.
with yeah.
Yeah, so we're almost done with the initial introduction.
Yeah, yes. I think I got a glimpse of what kind of a brief profile. So shall we just go ahead because we have less time?
I'll just explain on the form bit and then we can go ahead, ma'am. So I've shared the form. Whatever data collection we did right now, it'll be similar to that. The fields are name, age, phone number, gender, preferred time of the day when you would want to help in this counseling process, whether you'll be able to spare a lot of time, you want to do it only in the morning, only in the afternoons, evening or night, anytime. These are the options you have. And the next one would be preferred group of people that you would want to talk to or listen from. So children, adults, women, elderly, students. So it can be patients, specifically the family. All those things will be covered in this, so you can check the respective boxes. And then the next one is experience in listening, counseling, certification. So here you can mention what kind of experience you have, what helps you prepare yourself for this kind of a role, and that will also help us to allocate specific cases for you. And then the last one is professional counselor, yes or no. So in that the one before this, you can mention the certifications if you have had in psychology and all that. It will help us understand your experience, and those kind of cases can be allocated. So if you can fill the form, it will help us assign you to the right kind of work. So with that, I hand it back to Shobha ma'am again.
Okay. Thank you, Krishna. Thanks to all of you. I get a glimpse of the group. So from what I understand that there are three categories of people. On one end, we have the well-trained counselors with X number of years who are also in the counseling field, training, freelancing, etc. See, on on the other end, we also have, or in between, we also have people who are having basic knowledge, but not a skilled or a certified person. At the other end, we have people with no actual or a certified knowledge about counseling, or they don't have trained capabilities, but they are genuinely interested. They want to reach out, they want to help, and they have, or they can contribute something very, very important, the resource that is time. So we have a blend of all three categories of people. So the next step would be to classify them and based on their expertise so that it becomes easy for us to match and refer people. That's something very important. So going ahead with what is expected or what is to be done, uh, let us talk about, as I was telling you in the very beginning, for those of you who joined a little late, I just want to quickly tell that counseling is something extremely important and most required in the present day context. But at the same time, there is a very big lacuna or gap, and there is an acute shortage of trained counselors. This gap has always been there, even pre-COVID, but especially now, there's a big void. But at this juncture, we cannot have people who are here with good training or skills, because counseling really requires training, certification, you know, clearing certain exams, levels, etc. But since we need somebody to hear to people, a shoulder to cry, we are looking at empathetic listeners or volunteers to listen. So let us not call ourselves as counselors. We could call ourselves as listeners or listening volunteers. This is what I had already mentioned. So I just made a quick resubmission of the same thing. So in that context, I was talking to Krishna, it could be something like a psychological first aid, because we are not here as trained counselors, as we already told you. So what is that we are giving is a psychological first aid, just like how first aid during that very important golden hour before the medical aid reaches, we are there to take care, to offer that little help. So in that context, as listening volunteers, you all could be there to give that psychological first aid, to fill that gap, to be that listener by the side, so that people can have that solace. So if that is so, what are the qualities that are required? For a counselor to be a listener, baseline, a lay counselor or trained counselor, these are some of the prerequisites, whatever level you are. So number one is, it's very important that one is a good listener. And as I told you, to listen, you need to be open-minded, open heart, and suspend all judgments, not have a preconceived notion, be there with your mind and heart open. And time is very, very important. And being there in person, in the sense whether online, on phone, that's very important. So being a good listener is extremely important. And when you say being a good listener, shut ourselves to all the differences in the form of caste, creed, socioeconomic status, etc. Just be there, accept the person for what he is. That's very, very important. And secondly, very importantly, it is very important that as a listener or as a counselor, you need to be well informed about COVID. That's exactly what President-elect Lavanya was telling. She has just gone through COVID. So, madam, I will be in a better position to understand. Yes, she has been there. But many people, let's not hope that you are there and come back with the experience. We don't want that experience, but be well informed, be well aware. So we need to be aware and know the difference between facts and the hoax, because there is a lot of messages. In fact, media is inundated with messages and information. So we should be able to understand what is right, what is wrong, and be well informed. So that you don't have to be a doctor, but you need to have the basic information, so that we need to be sorting out the fear from the fact when you get calls of your clients, because that's very, very important. As one of the participants was mentioning, 96 and 97, and they get into panic. And we should be able to tell them that up to 95, it is still fine. Even before, even less than that, proning position can be done. Don't need an oxygen cylinder or a ventilator for all that. So that panic and fear is something that we really have to address. So for that to happen, being well informed about COVID is very, very important. And having a genuine interest in people, very important. That's basic. I might be having time, I might be having good patient listening, but if I don't have genuine interest to help people, then I cannot be a good listener. What is it that I get out of it? May not be any monetary gains. I may not be getting any name or fame, but unless we are genuinely interested in people and their suffering, we cannot be good listeners. So that's very, very important. And most of us, or all of you, being in inner wheel or Rotaract or Rotary, I assume, and it's a well-known fact that interest in people is there in Rotarians and Rotractors and inner wheel members. So thanks for that. And empathy is something extremely important. Understanding the person from his position, what is it that I can do for him, visualizing his suffering. So there's a lot of difference between sympathy and empathy. So what is required for a counselor is not sympathy, but empathy. That's very important. Patience in a calm manner. There are different types of people who can get into anger, shouting, abusing, taking out their anger on the system or medical fraternity entirely onto you, or they might be cursing God or their own life, many things. So we need to understand that here is a human being who has gone through a lot of suffering. And we need to have that patience and a calm manner to understand. And trust me, and you're not even by his side. You're not even able to be close to him and console him. All that you have is a phone call or a Zoom or an online platform. So with these limitations, you still have to be calm, composed, patient. So you have to develop that quality of maintaining that resilience and calmness and composure in you. That's very, very important. And ability to cope with emotional situations, ability to relate and adapt communication style with, because as I told you, people have different styles of communication. We have generally seen in your own family, you are very familiar with people who are more or less like you, maybe. But it takes all kinds of people to make this society. There are people who speak loud. There are people who swear. There are people who use abusive language. There are people who don't open up. There are people who don't speak, but they cry and sob. There are all kinds of people, and at the same time, they are undergoing a tremendous pain and pressure. So we need to be resilient, adapt ourselves to the communication style of people. That's very, very important. Give them a wide margin. We are here to just listen to them and help them, not to judge them, not to comment. So being non-judgmental is extremely important. Have the ability to encourage active coping, because I'm going to tell you the next slide what counseling is not, because there are no instant solutions. There is no magic wand which can just wish away COVID or get back their loved ones back to their homes. None of that is possible. In fact, you will understand, you'll remember my words when you're actually listening, you'll feel so helpless. Oh, I feel, we have reached a dead end where I can't even help. What is it that I can do? Here is a person who is saying that he or she has lost so-and-so in the family. What can I do about it? How do I fill that gap for him? So we feel very helpless. We feel lost for words. But in spite of all that, we need to encourage that coping. So it is very important that as a listener or as a counselor, we are equipped with these skills. So therefore, the training what is to be given to all of you is extremely important. Although this is not going to be a long tenured counseling course, although that is required, most required, it's not possible. But few hours of training is still required. I was talking to Krishna Arjun, so they will also get back to you and see minimum hours of training if that can be given. So that's something very important, because we need to encourage what are the options. When you feel that all doors are closed, what is it? How do I instill that courage in that person? How do I build that coping mechanism in him is something what we have to teach or guide. For that, I need to have. So sometimes you also have to be an optimistic person. You can't be giving something which you don't have. So end of the day, you should be pleasant mannered. You should be optimistic. You should have a lot of courage and perseverance. That is something very, very important. And be aware of people's cultural preferences, extremely important, because people are here in Bangalore. You are here, but you might be getting calls from elsewhere. We have to be respectful of somebody else's cultural preferences, their needs, their eating habits, their beliefs, their convictions, etc. So these are very few points, not everything I've put here. This is just a gist. And then lastly, I would like to speak about what counseling is not. Many a times people come to the counselors thinking that they get a quick instant reply or an answer or a solution for their problems. Counselor is not God. Counselor does not have any magical wand to do this and the problem disappears. So counselors and listeners have their own limitations. Very importantly, refrain from giving advices. We are very quick and very good at giving advices to others. But advice is not something what the other person at the other end of the phone is looking for. He or she has come to you just so that he can unburden, ventilate, emote, share. Unless he or she is looking for guidelines, referrals, let us not jump into conclusions, judge, and start giving advices. So counseling is not giving advice. So when we are listening, let's not get into that quick thing that I need to help, so I should be giving advices. No giving instant solutions. That's not counseling, and that is not our job. No giving instant solutions. And providing an emotional crutch. The end use or the end goal of counseling is to make that person a little dependent and then more independent. And as the days progress, making him a little more and more dependent. Counseling is more like giving a person a walking stick, helping him to walk, not giving him a crutch and making him dependent on the crutches. So we need to enable the person to get up. If he has fallen down, help him to stand up. If he has stood up, make him walk. If he's walking, make him run. That should be the thing, not making him dependent that every other day he calls you and say, what do I do? Yesterday you told me this, I fulfilled this, now what? We are not there eternally 365 days to help this person. We are not here to cause that emotional dependency, but what is important is that little independence. That is something what we have to do. And no quick fix, whether it is for corona or for any other emotional concern, there is no quick fix. So some of you were talking about grief counseling. Even going through grief counseling, there are stages of disbelief, stages of normalcy, stages of getting over that. Nothing can happen. We can't skip these stages and be or achieving or going to the last stage there. So there are stages of grief. A person has to go through that. We can only enable them to go through these stages. That's all. Otherwise, there is no quick fix solution for any of these, whether it is for their mental agony or their physical health. So these are some of the limitations. So this is very, very briefly what I've spoken about the requirement. So in order to get these qualities, yes, training is required. Some are temperamental. Some people are born with those qualities. Some can develop it with training. Some have already got these through your training and certification, which have already thing. But there are people who are requiring your help, your concern, and your patient care. So with that need, this platform has been created. If it still interests you, and if you're convinced, yes, help is required, let's see a thumbs up from your end, please, if you think counseling is the need of the hour. Thank you, sir. Naveen sir shows me a quick thumbs up. Naresh, yes, yes, yes. Very true. Absolutely. In fact, today, what is killing people is not the pandemic, but the fear. Pandemic can be managed, but the fear is something which is really going overboard. So if, as listening volunteers, you're there to bridge that gap and to instill that courage and confidence in people and tell them that this too shall pass. This is momentary, good days will be there, and eventually things should be coming back to normalcy. Till then, we are there. Rotary is there. The counseling group is there. The listeners are there with you. If we can give this, I think that's a big kind of support we could be giving. Okay, I just stop here. Any questions and how to go about is the next very important thing that's before us. How many man hours we have or the group can set aside to get themselves trained. How the ones who are already trained can contribute. How do we divide ourselves into resource groups? And very importantly, a database of referrals also has to be created, because many a times you don't know when the person is too very overwhelmed. He or she has got a suicidal tendency, or you understand that so-and-so is at the brink of going into depression, where you clearly understand that you cannot handle. You can't just leave that person, that case there. It has to be referred to a next competent authority or a person. So these are something that we have to plan it out and help handle. So I think the group is going to explore all these possibilities and how we streamline, because that is something very, very important. So I just stop here. Any questions at this juncture before I hand over to Krishna and Guru?
So there's a question on can we add non-Rotarians to the group? So Shobha ma'am, would you like to take that?
Krishna, you take a call as a COVID war room. Is there any guideline when the COVID war room has been created? What is the guideline we have received from the district? So
no. So we can have, see, you if you want to have counselors as in non-Rotarians who can help out, any help is good help. Let's
then
take
fine,
them.
sir. Then fine, because we need people.
Correct.
We need, madam,
We need
this is war. As I said, in love and war,
Yes.
everything is fair.
Fine, then. More the number of trained people, the better it is for
Sorry,
us.
yeah, sorry.
It is fine. So
I was on another group. Sorry.
yes, sir. If you could come,
ಮಾಡ್ತಾ ಇದೀನಿ.
if the Google Forms can be shared and more people can join, why not? Yeah, I was just checking out if there is any guideline on that. Then I think you can.
Yes.
Talking.
So,
I mean, I will tell them also because that's
Please.
why. Sorry.
yeah, Karthik, you had anything else to add?
No. So one thing is we are experimenting with our Rotarians. So the beneficiaries first will only be Rotarians, and then we will extend. If it works, then we let others take the call.
Okay. It's up to the group.
Yeah.
There is one question, ma'am. What is the duration of a typical counseling session? So when you say typical counseling session, are we talking about present day times of COVID or in general? I don't know what we are. Counseling is basically a very, very customized service. It's a process. It's always, we say that counseling is not just a one-time service. It's a process. It can be spread across few sessions over a couple of weeks, over a couple of months. It could be. But here, what we are saying in the COVID context, it could be a phone call. And again, it depends on the requirement of the person. But since you will be also committed with your other work and you are going to set aside that amount of time, probably we could fix a minimum and a maximum time for that phone call or a Zoom call. Isn't it, Krishna? That you could arrive at. Otherwise, people can just go endlessly. Although we respect their feelings, so we could fix the time. All these modalities will have to arrive. This is just a basic meeting to understand all of you and your frame of mind.
Good evening. My name is Shashikant. Good evening, doctor. My name is Shashikant. I have been listening to very patiently all the information what you have shared. First of all, I would like to volunteer for this particular program. As said, I don't have any special skills, but I have found out I have a good listening capacity. So I could be a service either in English or in Kannada. And of course, I'm a businessman. I can be available only after 7 p.m., but not for more than half an hour or 45 minutes. That's the first part. Second part is once we try to understand if a person has a more serious issues, then we can handle. Is there any place where we could guide that person onto a more professional
yes sir, there are many. So before we put you on to counseling as volunteers, we will be furnishing all those details to you, because you should have that inventory. Where do I send them? What do I do next? So those basic guidelines will be furnished to you, sir. It has to
will our identities be kept anonymous, or how is it, madam?
Generally the clients, whenever in the counseling process, the client's information is kept confidential. And unless you wish, a counselor's confidentiality is not a thing here. But if you need, so maybe that's exactly why the platform has been arranged in such a way that today you are available, Shashikant sir, and tomorrow for the same client you are not available. His case will be dealt by somebody who is equally competent too. So that can also be done. So if you wish, so it can be. But otherwise, in the general parlance, it is the identity of the client that is kept confidential. If you wish, so we can look at that.
No, I'm comfortable with my identity being known. That's not an issue at all.
Unless there is any reason for that, then we could help you out. Otherwise, it is not.
No, there's nothing like this.
Okay.
Thank you, madam. I'm through with my question. Thank you.
Thank you very much.
Thank you, Dr. Shobha. I have few things. Can I ask? This is Arvind Naidu here.
Okay, Arvind. Yeah.
One is we need to take a train the trainers concept.
Yes.
Otherwise, what would happen is everybody is interested. They have a good listening skills, empathy. There might be a small gap. I think we can fill that one. If we can run 2 days or 3 days with the volunteers.
Yes, that is very important. So how many hours the group is ready to set aside? If Krishnarjun and the team can come back with that, it is mandatory. It is very much required the trainers thing is required, and we need to have those basic exercises in understanding listening skills, giving little exercises in listening, and probably a quick understanding of each one's knowledge about COVID, the present scenario, the challenges. So these things has to be done. Very importantly, the TOT is required.
Okay. Next one is, see, first few days, especially about 3 to 5 days, for the first 3 to 5 days, what we are planning to do is a planned time slot. That means we can have a Zoom call or any other video platform call for about 1 hour or 2 hours, where the patients or the patient's kin can log in and ask questions. We are not giving them a unlimited time frame, but then 2 hours very clear. They can ask the questions. Most of the people can understand from the question asked. If that could be their questions itself, we can address a bigger crowd. If we can run this for about 3-4 days, most of the other people will also can get trained. It could be a on the job training, like you are trained the trainers, one concept. On the job training is the another concept. If you are okay, we would like to run this along with a one or two doctors, or if you have anybody else known to you, 3-4 people can take the questions. 2-hour sessions. Tomorrow 1 2-hour session, and Tuesday 2-hour session. Krishna, what do you think?
Noting it down, Krishna.
Yes. So the plan is for the professionals. They can get into action, and whatever they see from their experience of late, what's been happening, all those can go into FAQs, which can be referred by the people who are not experienced. But
Correct.
The way we would want to function is, before the case is given to them, we'll identify what is the level of the case and allocate the case which they can handle. So the train the trainer is mandatory. So we'll go through that and then start allocation.
Krishna, there's another direct message to me, how the Rotarians will be assigned the cases, for sessions. So what is the modality, if you could tell them that?
So as of now, we're planning to set up some phone lines, and sir is helping us with that. So that will be operational from tomorrow or day after. So after that, we'll start receiving. So primarily, the focus is currently with the Rotary family. It's being rolled out as a pilot, and once we have we'll need a team which will start receiving these calls and messages saying we need this service, and then we start addressing or assigning these cases specifically to the people who are on board. So they would, in the form that they fill, they would have let us know the kind of people they would want to counsel or listen to, as well as the time that they are preferring to be a part of this. So this is not going to be a 1 week thing or a 2 days thing. So it's going to be a longer term commitment. It can run for a couple of months. So we want serious people to take this up, so that the trainer's time is also valued. So that's it about, as of now. That's
ID numbers will be generated for the cases, so that we have continuity while handling these cases. So in case so and so is not available for the next lot, the client's interest is always taken care of. So that continuity will be maintained. So I think Krishna, even at the technical end, you need some good solid support to maintain.
Yes, definitely.
Yeah,
we do.
That is there. Krishna, I'd like to clarify. Tomorrow it is starting. Tomorrow by around about 9:30, 10, or probably before 11, our phone line and other things are starting. We are expecting DG to open it.
Okay.
I was just thinking, can we, for counseling, can we have one more separate line itself? Would that make sense? Because you can do mass dialing. Suppose Shobha is dialing from her mobile, but the receiver would not see her mobile number. They would see the general
number, the helpline number.
Yeah. That is one thing which I have not explored. I have to explore that.
Shobha ma'am, we would need your suggestion on this. Would a telephonic
that's very important.
Yeah.
It is important, Krishna. A common helpline number should be important, which can be multiply operated, received at different ends. It's like how the telephone exchanges would work. So that's very important. Otherwise, the lines will get endlessly busy, and then the frustration and the beneficiaries, that will increase. So we have to facilitate that. At this juncture, I would like to acknowledge the presence of Madam Rotarian Rashmi Tangsali. Good evening, madam. Nice to have you here.
So, Rashmi ma'am, welcome, making you co-host. Yes, so basically, the phone line can be. I was wondering whether we should have the counseling sessions on the phone line or on a platform like Zoom. So we can receive the cases through email as well as on phone, and an appointment will be set up for them to come on Zoom and complete the session. So that can be one of the options that we can pursue. Or if you feel a telephonic conversation should be good enough, then we can completely depend on the line itself.
And at this point, I request the others, who are here, the seniors, we all could collate all our resources. If you have contacts with any other freelancers, free counselors available, and help anywhere at your end, let's pool in all our resources so that it's all connected to one particular thing, and we can build up that. That is one thing. And the next thing, very important, is we have to schedule the train the trainer sessions, the time and date, if you can talk about that, and how long this can go on and how many hours that is required. And there should also be one place where the counselors can come back and report to. So that is also very, very important. What is if they have reached a dead end or they don't know where to go further. So somebody senior should be ready to address that. So
Yep.
these are the loose ends we have to tie, Krishna. So that has to be
Definitely,
addressed.
definitely.
Yes, sir. Naveen sir has. And Lavanya, yes, please.
Yeah, hi, Dr. Shobha and team here. Great initiative. Been sitting at home, wanting to do something, feeling impatient and doing our bit. But counseling is something. When this opportunity came, I was very happy. Um, I'm a strengths coach and I'm a behavioral transformation expert. My line is coaching and consulting for the last 30 years. I just want to pick up from what you said last. I can bring in at least about 5 to 10 um, coaches basically who actually have, this is our profession. We work, we bring about behavioral transformation in people and organizations. And I've done a lot of counseling in the last 1.5 years, counseling heads of organization to deal with the COVID situation, the trauma, the uncertainty, the sense of helplessness, so to speak. So that has been my experience in coaching for the last 1.5 years, predominantly for my clients. So I've submitted my form and I've said I'm available anytime and anybody is okay. I also conduct a lot of trainer sessions for people to become coaches themselves, possibly training, coaching and counseling a little bit of, there's a humongously large overlap. The basic requirements are the same. So I put up my hand to be of help in any
Thank
which
you,
way
sir.
to this team.
Thanks.
And I would like to add one input. I think as we actually finish the training and we start counseling, we need to have a debrief session every evening where everybody will log in and can talk about their experiences.
Yeah, that's exactly what I
That
was where I have to
session,
refer back.
yeah.
Not
So
every
that
day, it
session,
has to be done. Time and again.
absolutely. That session will help everybody else learn from what somebody else has done better
Very true.
and what to avoid doing. And I think that is critical part of this journey and process.
Very true.
So with you.
Thank you,
Thank
sir.
you, sir.
Thanks for that.
Fantastic.
Thanks for adding value, you're ready to bring in people. Only thing, this is purely voluntary. No
Sure.
conflict of interest should be there. So
Absolutely.
anyone who can gel with the philosophy and principles of Rotary, more than welcome.
Absolutely.
Thank
Absolutely.
you. Yes, Lavanya.
Got that. Yeah.
Krishna, please unmute
Yes.
Lavanya.
Yeah.
Done.
Ma'am, like you said, I just wanted to add that, trained people are here, people who already are counselors, other people who are willing to work now. I think we can divide them into smaller groups.
Exactly.
And
Yes.
this supervision is very important. And also about logging in the clients that we are getting. It is, we all know as counselors, we make notes about a brief notes about what the session was about and all that those things have to be really told how to do, what to do, and some of these questions and how to not ask direct questions and open-ended questions. Maybe if we could make some questions, all these things ready for them, ready reckoner kind of thing.
Yeah. The trainer should be addressing on these, Lavanya.
Yeah.
So it should be done. And I also have a couple of questions directly sent to me, how the records will be maintained. So for now, it'll be on Google Forms. So as and when you take the details of the client, it can be entered on the Google form. So
you could probably make smaller groups, ma'am, with people who are already trained. And like Naveen sir was saying, we all at least report to each other and learn from each other. That would be great. Everybody will have confidence enough to go on and do the sessions.
I'm sure the team led by Krishna and others, they would be doing that. And there is also a question like, regarding case taking, etc. Definitely. So the format or the templates will be discussed and shown to you, because it cannot just happen in open, So there should be a structured format. There should be something which can go as a guideline to everyone. There should be uniformity, whether it is case taking, whether it is reporting, whether it is documenting, there should be a thing. So all this will be given during the TOT and the next sessions that is going to happen. So many of these will be addressed. This was just a preliminary, just to give you a glimpse of what is going to happen and just to get the pulse of the participants. It's just that.
So the first few days will be handled by professional trainers and counselors. And apart from the TOT that's going to happen, during the TOT, they'll also share what are the observations they have with the current kind of cases that they're getting. So all of those things will be available as documentation for us to refer back, and templates and all those things the trainers will give us, so that you'll also have a script of sorts on what to say and what not to say. So this has been a brainstorming session apart from introduction to what we are trying to do. So if you have any suggestions, you can let us know. We can again look at it. We can, if it's really good, we can try to implement it as well.
Okay. So how was the session?
Wonderful, Shobha, Dr. Shobha. That is no doubt. I think we are all motivated now. Just 2 points I would like to add. All the sessions, calls, whatever you'll have, it is all recorded. If needs to be replayed and put it across, we can do that.
But that with the client's permission, you mean to say the client's case narration will be recorded?
No. With their permission, of course. There is an option to record it. If they want, we can play that. But we'll play a message. It tells that for learning purposes and other things, this session is getting recorded. If you opt out, you can opt out.
That way, okay.
And to give some kind of a confidence and soothe the participants or the patients, adding one doctor could be a big help. Do you think that is required?
Yes, I'm sure by the time we emerge out of this and form the core group, there would be, I think, doctors, trained counselors in the core group should be there.
Okay, wonderful. I think let's look out for some good doctors.
Yes, the remaining things, the next step of action, if you all could get in and constitute, that would be really nice. As and when required, I'll be there to help you all. But if you could just structure the training and schedule it, it'll be really nice.
Definitely, ma'am.
Okay.
So look out for invites for trainings that will be happening in the coming days of the week. And in case you're not able to make it around the same time due to any other commitments, we'll see if we can go live on YouTube as well, so that that link can be forwarded and you can refer to that later on. Okay. So before you go live to the patients, we'll also probably have a test of sorts, so that you're also confident and we are also confident that you'll be able to. It's going to be a simple one, but you'll have that good confidence going into the training session or the counseling session.
All right.
Yeah, good session, Shobha. Thank you for motivating everyone.
Thank you so much. A last line I would like to just note: in counseling, we always refer to them as clients or counseling. No using the word patients. They're not patients. So just a small correction with humility, I'm just saying. So we'll call them as counselors or clients. That's it.
Perfect.
Okay.
Thank you, Shobha ma'am, for making time.
Thank you.
And thank you each and every one of you. If anyone hasn't filled the form, please do fill the form so that we can start working on the same. Yeah. Thank you, everyone.
All.
Thank
Keep
you.
yourself
Thank you,
motivated.
Krishnarjan.
You
Thanks
are
for
more
setting this up.
important. Each of you are very, very important wherever you are.